ever gone to the doctor for some routine blood work and one of your liver function tests came back elevated? Well, the most common reason the liver function test elevate is alcohol, too much alcohol. But if you're a non-drinker, the second most common reason would be non-alcoholic fatty liver disease, NAFLD. And this is very, very common nowadays. Basically, what happens is if you're eating more carbohydrates than you're able to burn for fuel, the carbohydrates will get converted into fat and that can accumulate in your liver, which can create inflammation and irritation of the liver, which leads to an elevation of those liver enzymes. Now, the good news is this is reversible. So if you decrease your carbohydrate consumption and if you lose weight, oftentimes this condition will reverse. If you ignore it, it can progress into something called NASH, which is non-alcoholic steatohepatitis, which can turn to cirrhosis of the liver. So it's a pretty big deal, and it's actually becoming increasingly common. So what do you do if you have an elevated liver function test? Well, first of all, this is not something to ignore. And the crazy thing is, oftentimes this will occur and you have absolutely no symptoms. The symptoms of this can be rather vague that we could attribute to so many other things. You may have a pain in the upper right abdomen where your liver does live. You may have unexplained fatigue, muscle weakness, or sometimes unintentional weight loss. But many patients are not going to notice any symptoms whatsoever. They're going to just see this lab abnormality. The most important thing is to try to cut carb intake and to lose weight. Now, some of my favorite ways to help patients lose weight are to check their mitochondria and see what they may be deficient in that is making it harder for them to lose weight. I also am a big believer in hormone and thyroid optimization to make weight loss a little bit more easy. Um, so it is a big deal. It needs to be reversed so that it doesn't turn into something more serious. One of my favorite tools for helping people reverse the elevation of the liver enzymes is to use a supplement from the company Cellcore called Advanced TEDCA, which helps to stimulate bile flow. And I've seen great success in having that supplement alone turn around the elevated liver enzymes. If you need help with this is our jam. We'd love to help you. But that's a little bit about non-alcoholic fatty liver disease, which is increasingly common. It is reversible. Reverse it by identifying and fixing the four root causes of disease. And that's where we feel right now and protect ourselves from future diseases.